If you are over 50, bowel health investigations are a normal, necessary part of life. While the idea of a colonoscopy might cause anxiety, the procedure itself is highly effective and completely routine. That is why the Best of Health has put together this definitive 2026 guide to help you navigate NHS and private healthcare decisions with confidence. The standard route for most people is the NHS routine pathway. The primary advantage here is that the care is completely free at the point of use. But as this timeline shows, the system is under significant pressure. As of late 2025, over 71,000 patients in England were on the colonoscopy waiting list. For the patient, that translates to an 8-week to 5-month wait, compounding medical anxiety. There is a separate path. If your GP suspects cancer, the NHS prioritizes you on an urgent 2-week wait pathway to provide a rapid diagnosis. But that urgent route is strictly regulated. You must present with specific red flag symptoms to qualify, which means it isn't available if you are monitoring a known condition or investigating mild symptoms. For non-urgent patients, the NHS system requires a choice between receiving free care or enduring a long wait, which is why many now consider the private sector. Going private changes the timeline completely. Instead of waiting months, you can usually have your procedure completed within 3 to 10 working days. This chart shows baseline prices for private colonoscopy across major UK providers. The initial cost starts between £1,849 and £2,690. Practice Plus Group is the most cost-effective option, with a fixed price of £1,749. Premium London providers like HCA often quote above £3,500. While pricing varies by location and hospital group, that rapid 1 to 2 week access is the universal standard across the private sector. While private care solves the problem of speed, the challenge for patients shifts to navigating the financial opacity of these provider pricing structures. Booking based on the cheapest initial quote carries significant financial risk if the provider uses an itemized billing model. This chart shows how bills stack up. Histology fees for biopsies add £150 to £400. Removing a polyp is billed separately. Together, these add up to £600. Upgrading to anesthesis-led sedation adds £250 to £450. Finally, separate consultation fees add another £300 to £600 to your stack. When these itemized fees are added to a premium hospital's higher base rate, the final invoice can easily climb past £4,500. To avoid this, demand a fully all-inclusive fixed-price package from providers like Ramsay or Practice Plus. These typically start around £2,500 and cover everything from the first meeting to the final results. Securing a fixed-price package is the only reliable way to achieve total financial certainty and prevent post-procedure billing shock. If you have private medical insurance, your policy will typically cover these costs. However, insurers have very specific rules. The primary hurdle is the pre-existing condition clause. If you have a history of bowel issues, the insurer will likely decline the claim. You should also know PMI generally excludes routine screening. You typically need to be investigating new, active symptoms to qualify for cover. Do not book an appointment until you have obtained official pre-authorization from your insurance provider. PMI is an excellent way to bypass waitlists, but failing to understand these symptom-based criteria risks leaving you liable for the entire bill. Beyond the finances, it is helpful to know the physical reality of the procedure, starting with the preparation. To give the camera a clear view, you must take a strong laxative solution and follow a low-residue diet the day before to completely clear the bowel. We will be direct. The resulting discomfort from this preparation phase is universally considered the most challenging part of the experience. The procedure itself is much easier. Most patients choose mild sedation, inducing a relaxed, drowsy state. The exam is painless and often forgotten immediately after. If you choose sedation, you cannot drive home and will need a responsible adult to stay with you for the rest of the day. Enduring the temporary discomfort of the bowel prep is a small, worthwhile trade-off for a safe and accurate diagnosis. This decision tree organizes choices by urgency and budget. For urgent symptoms, the NHS 2-week wait pathway is prioritized. For budget-conscious self-payers, Practice Plus offers the lowest fixed price. For premium facilities, networks like Nuffield or Spire average £2,600. Ultimately, there is no single correct choice. The right path is the one that aligns your current health needs with your financial boundaries. Before you call a private hospital to book, keep this safety checklist in front of you. Explicitly ask the provider, are biopsies and histology included? Is sedation anesthetist or nurse-led? Is the follow-up consultation included? Clarifying these terms takes 10 minutes on the phone, but it is the best defense against hundreds of pounds in surprise invoices later. This guidance was developed by The Best of Health to bring transparency to essential medical decisions. For the full provider directory and more tips on preparation, visit us at thebestofhealth.co.uk. Armed with pricing transparency and a clear understanding of the procedure, you can now take control of your health decisions with confidence.